Hello, everyone. Let's explore AI-augmented unified sales hubs in life sciences, driving compliant growth, productivity, and predictive commercial excellence. Let us begin by understanding why traditional field force models struggle in today's environment. Across life sciences, commercial organizations are operating in a structurally different landscape than they were even 5 years ago. Access to healthcare professionals is constrained. Hybrid engagement is now permanent. Regulatory scrutiny continues to increase. Data privacy expectations are rising globally. Meanwhile, product pipelines are more specialized, competition is more targeted, and payer dynamics are more complex. Yet many commercial organizations still operate with CRM-centric workflows that were designed for a different era. Field representatives often spend substantial time preparing manually for calls, navigating multiple systems to piece together basic account intelligence. CRM systems are frequently used as reporting repositories rather than intelligent sales engines. Territory planning is done in spreadsheets, insights arrive too late to influence behavior, data sources are fragmented across marketing automation platforms, third-party data providers, claims feeds, medical systems, and incentive compensation tools. The result is predictable. Representatives struggle to prioritize effectively, managers lack real-time visibility, forecasts are reactive, compliance review cycles slow down content deployment, and leadership teams find themselves investing heavily in technology without realizing measurable productivity gains. This is not a people problem, it is an architectural problem. What is needed is not another CRM upgrade. It is a unified AI augmented sales hub built for compliant growth in a digitally orchestrated ecosystem. Now let us examine what that truly means. Most life sciences commercial models still revolve around CRM as the operational core. Representatives log calls, capture notes, track samples, and record interactions. Managers review dashboards summarizing activity metrics and basic performance indicators. Marketing pushes approved content. Sales operations reconcile data across systems. But several structural limitations persist. First, workflows remain largely manual. Call planning often involves downloading territory reports, reviewing recent prescriptions, scanning previous call notes, and manually determining which accounts to visit. There is limited dynamic prioritization. Second, insight latency is high. Prescription data, claims feeds, and engagement signals often arrive in batch cycles. By the time insights are processed, the optimal engagement window may have passed. Third, data fragmentation is widespread. HCP profiles may exist in multiple systems with inconsistent identifiers. Marketing engagement data lives in one platform, CRM interactions in another, medical inquiries in a third, and sample accountability in yet another. Fourth, compliance constraints introduce necessary guardrails, but they are often implemented as friction rather than embedded controls. Representatives may hesitate to use digital tools if they fear audit exposure. AI features are frequently disabled or constrained because governance frameworks were not designed into the architecture. Fifth, face-to-face access has declined in many specialties. Hybrid models require seamless coordination across in-person visits, email, webinars, portals, and call centers. Yet, orchestration across these channels is often limited. This is the context in which commercial leaders are asking a fundamental question. How do we increase productivity and precision without increasing compliance risk? The answer lies in rethinking the commercial technology stack as a unified platform rather than a collection of tools. A unified sales hub is not simply a modern CRM interface. It is an integrated commercial operating platform that centralizes data, intelligence, compliance, and execution in a coordinated architecture. At its core, it must provide a comprehensive HCP 360 view. That means a consolidated profile combining demographic data, specialty information, prescription behavior where legally permitted, engagement history across channels, formulary context, affiliation networks, and approved content exposure. It must enable territory analytics that dynamically prioritize accounts based on potential, engagement responsiveness, and strategic objectives. It must embed AI-powered call planning, suggesting optimal sequencing, messaging themes grounded in approved claims, and channel mix recommendations. It must integrate digital engagement signals in near real time so that field actions align with marketing campaigns and virtual interactions. It must provide forecasting dashboards that link activity to outcomes, enabling sales leaders to understand drivers rather than just lagging indicators. It must ensure compliance-aware content access, meaning representatives only see approved materials aligned to the right indication, audience, and region, and it must support performance tracking tied directly to incentives and coaching insights. The distinction between a CRM upgrade and a platform transformation is profound. A CRM upgrade changes the interface. A platform transformation changes how data flows, how intelligence is generated, and how compliance is embedded. Now let us explore the architecture required to support this model. At a high level, a unified sales hub consists of multiple layers working in coordination. Let us start with where commercial data originates. Data enters the ecosystem from diverse sources. These include internal systems such as CRM interaction records, marketing automation platforms, medical information systems, and sample management tools. They also include external feeds such as prescription data aggregators where legally permitted, claims data, formulary data, demographic enrichment, and event attendance records. All of this information must converge into a commercial data platform layer. This layer typically includes a cloud-based data lake or lakehouse environment where raw data is ingested, standardized, and linked using master data management processes. Unique identifiers for HCPs and organizations are critical. Data quality rules must validate completeness, consistency, and timeliness. Above this sits the AI and analytics layer. Here, feature engineering pipelines prepare data for predictive models. Machine learning models generate engagement scores, territory potential estimates, churn risk indicators, and demand forecasts. Model outputs are stored in serving layers optimized for real-time or near real-time access. An API and orchestration layer exposes these services to downstream applications. This is where microservices provide access to HCP profiles, next best action recommendations, content eligibility checks, and compliance validation services. Secure APIs ensure that each consuming application retrieves only the data permitted for that role and region. The sales experience layer sits at the top. This is the representative-facing interface, often delivered through a web or mobile application integrated with CRM functionality. It presents prioritized accounts, AI-generated insights, approved content, and call documentation tools in a unified workflow. Parallel to these layers, a compliance and governance layer operates as a control plane. This layer enforces content approval workflows, promotional boundaries, audit logging, and model governance policies. It ensures that AI outputs are constrained within approved claims and that all interactions are traceable. Finally, a monitoring and performance layer provides observability across the stack. It tracks system uptime, API performance, model drift, data latency, user adoption, and anomaly detection. It is critical to distinguish between the execution plane and the control plane. The execution plane handles real-time interactions, recommendations, and field actions. The control plane governs policies, permissions, content approvals, model validation, and audit controls. Keeping these logically separated enhances scalability and regulatory defensibility. At this point, you may be wondering how AI fits into this architecture without increasing compliance exposure. Let us examine AI-powered sales assistants in detail. AI in the field force context should augment human decision-making, not replace it. One use case is the sales concierge agent. This assistant aggregates HCP insights before a visit and generates a structured briefing. It may summarize recent engagement, highlight formulary changes, surface relevant approved messages, and suggest discussion themes aligned with strategic priorities. Another use case is automated call summary generation. After a meeting, natural language processing tools can transcribe and summarize notes. However, guardrails must ensure that summaries remain factual, do not introduce unapproved claims, and are editable by the representative before submission. Next best action recommendations represent a more advanced capability. By analyzing historical engagement patterns, prescription trends where permissible, and content responsiveness, models can suggest which accounts to prioritize and which channel to use next. Territory prioritization algorithms can re-rank accounts dynamically based on updated signals. For example, increased digital engagement may signal receptivity to follow-up visits. Voice-driven CRM updates reduce administrative burden. Representatives can dictate notes, which are structured and validated before saving. Conversational copilots embedded in the sales interface can answer policy questions, retrieve approved content, or explain incentive plan metrics. However, These capabilities require robust guardrails. AI outputs must be constrained to approved content libraries. Generative models should not produce new promotional claims. Human review remains essential. All AI generated outputs should be logged and traceable. Model performance should be monitored for bias, drift, and unexpected behavior. Regulatory authorities globally are increasingly focused on transparency and accountability in AI systems. Commercial organizations must document model objectives, training data sources, validation processes, and oversight mechanisms. Now let us move deeper into predictive analytics and forecasting. Demand forecasting in life sciences typically combines historical sales data, seasonality patterns, promotional activity, market access variables, and epidemiological trends. Modern forecasting models often use ensemble approaches that combine time series methods with machine learning algorithms. These models generate baseline forecasts and then incorporate scenario variables such as changes in promotional intensity or competitive launches. Territory performance prediction models estimate expected outcomes based on account mix, access constraints, and engagement frequency. These models can help allocate resources more effectively. Engagement scoring models analyze which combinations of channel, content, and cadence drive response for different segments. They rely on historical interaction data and outcome signals. Pipeline risk detection uses anomaly detection techniques to identify territories deviating significantly from expected patterns. Early detection enables proactive intervention. Scenario simulation tools allow leadership to test hypothetical adjustments. For example, what happens if virtual engagement increases by a certain percentage, or if sample distribution changes. It is critical that these models are transparent to users. Black box outputs without explanation undermine trust. Providing interpretable drivers enhances adoption and governance. Next, let us examine omnichannel integration. Field visits are only one part of the engagement ecosystem. Email campaigns, remote detailing sessions, webinars, medical portals, and call center interactions all generate signals. A unified sales hub must ingest these signals in near real time. When a healthcare professional opens an email, attends a webinar, or downloads content, that information should update their engagement profile. Real-time orchestration engines can adjust next best action recommendations based on these signals. If an HCP has just engaged deeply with digital content, the system may suggest a follow-up visit focused on a specific theme. Integration requires standardized event tracking, API connectivity between marketing platforms and CRM systems, and consent management processes aligned with data privacy laws. True omnichannel orchestration is not about sending more messages. It is about sequencing interactions intelligently while respecting promotional boundaries and privacy preferences. Now let us turn to compliance and promotional controls. In life sciences, compliance is not an overlay, it must be embedded in the architecture. Content approval workflows should be managed through centralized systems that track version history, expiration dates, and indication restrictions. The Sales Hub must retrieve only the currently approved versions of materials. Audit trails should log who accessed which content, when it was used, and in what context. Call notes and digital interactions must be traceable. AI outputs must be validated against approved claims. If a generative model proposes language that deviates from approved materials, it should be blocked or flagged. Risk classification mechanisms can categorize interactions by promotional risk level. Higher risk scenarios may trigger additional review. By tying compliance controls directly to APIs and content services, organizations reduce reliance on manual policing and increase systemic safeguards. Now let us discuss privacy and security. Healthcare professional data is subject to varying privacy regulations across jurisdictions. Consent management, data minimization, and purpose limitation principles must guide architecture decisions. Role-based access control ensures that users access only data necessary for their function. For example, a representative may see territory-level insights but not national aggregate analytics. Encryption should protect data both at rest and in transit. Secure API gateways manage authentication and authorization. Token-based security models reduce exposure. Monitoring systems should detect anomalous access patterns, such as unusual data downloads or login behavior. Data retention policies must align with legal requirements and internal governance standards. Security and privacy cannot be retrofitted. They must be designed into the platform from inception. Let us now connect architecture to performance management. Commercial success ultimately depends on measurable outcomes. KPI dashboards should integrate activity metrics, engagement scores, and outcome indicators in a single view. Managers need visibility into both leading and lagging indicators. Incentive compensation systems should integrate directly with performance data. When representatives understand how behaviors link to rewards, adoption improves. Territory benchmarking tools can compare performance against peers with similar profiles, adjusting for market potential. Coaching analytics can identify patterns in high-performing territories and surface replicable behaviors. By linking the unified sales hub to incentive systems, organizations close the loop between strategy, execution, and reward. Now let us address scalability and operating model considerations. One frequent issue is CRM overdependence. Organizations assume that adding plugins or features to an existing CRM will solve structural problems without addressing data architecture. Another failure pattern is deploying AI without compliance guardrails. This creates risk exposure and erodes trust. Poor data quality undermines predictive models. Without reliable master data and consistent identifiers, analytics outputs are unreliable. Tool sprawl creates confusion. Multiple disconnected applications reduce productivity rather than increase it. Lack of adoption often stems from insufficient change management. Representatives must see clear value and reduced administrative burden. Recognizing these pitfalls early enables course correction. Now let us quantify business impact. When implemented effectively, unified sales hubs deliver tangible outcomes. Sales productivity increases as administrative time decreases and call planning becomes more focused. Targeting accuracy improves through dynamic prioritization and engagement scoring. Call documentation becomes faster and more structured through voice-enabled tools. Forecast accuracy improves as predictive models integrate real-time signals. Compliance risk decreases when content and AI outputs are systematically governed. These outcomes drive not only revenue growth, but also organizational resilience. Finally, let us look ahead. Emerging innovations include agent-based territory management, where AI agents continuously monitor signals and propose adjustments. Autonomous engagement optimization may dynamically adapt channel mix based on responsiveness within approved boundaries. Real-time predictive insights may move from dashboards to proactive alerts delivered contextually during workflows. Multimodal AI integration could combine text, voice, and structured data to enhance insights. At the same time, regulatory scrutiny of AI will intensify. Transparency, documentation, and human oversight will become non-negotiable. Organizations that embed governance into architecture will be better positioned than those retrofitting controls later. Over the next decade, competitive advantage in life sciences will increasingly depend on how effectively organizations integrate AI into unified, compliant commercial platforms. Those who treat AI as a tactical feature will struggle. Those who design AI-augmented unified sales hubs with strong governance, robust data foundations, and measurable performance linkages will define the future of compliant growth. Thank you for watching.